Joseph, do you want to intro?
Yes, thank you everybody for being here. Welcome everybody. Special thank you to the EFTCNJ members and supporters for being here, supporting us, supporting our work so we could do this. Special thank you to the EFTCNJ team for putting this together and working tirelessly behind the scenes to build community. So thank you all. And of course, thank you, Debbie, for leading the charge and creating a space for EFT in New Jersey and pioneering that place really, and really working hard to contain it and making what it is, making it a EFT pure methodology and keeping it as such, working tirelessly. 30 years of refining her skill, working on her craft, really excellence to the next level. And again, giving up your time and space over here for us to be able to learn more and bring us all together again. So special thank you to Debbie. And yeah, so we're back to the basics, right? Because we can never learn enough of the basics. Always that when our foundation is strong, we can deal with everything else. But so thank you for being here. And I categorized the questions that we got, and thank you everybody for sending in the questions into like more of like the process questions, like the process of EFT, some questions about stage 2, some things about how to handle when things come up between the couples, a little bit about the counter indicators people want to know, and the tango, some questions on the tango. We did get a lot of questions about the new EFTC and ICEFT mess, for lack of a better word, right now. Everybody's frazzled. Yes, everybody's frazzled. Nobody's sure what's happening with certification. What's the road to certifications? There are 3 different certifications right now. Your confusion is well understood. I wish we would get more clear directions from ICEFT. Arn and I have been speaking about seeing if we locally, at least EFTCNJ, can contact ICEFT, get everything clear, and get one of these Q&As to be specifically information about certification. So it's not going to be part of this Q&A, but we will hopefully dedicate a time for that, and your confusion is well understood. Okay, so process questions, Debbie. People want to know what's a good pattern to get into for starting sessions, or tips how to get started in session.
Great question. So I would say, like, if you are new to EFT and you're trying to kind of build up an EFT muscle, and you walk into session and you say, hey, how was your week? You've just taken yourself off the EFT path. So when you start a session, even somebody who's been doing it as long as I do, I say, hey, we left off last week with da 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 da, or we talked about this last week. So let me check in with you, because what I believe is so important is the focused part of EFT here is like we're taking a thread from the last session and dragging it with us to the opening. Now, there's 2 options. One is to take that thread over. The other option when you start an EFT session is if you see your clients or walk into the room or see them on Zoom, and you feel in your body like something is going on, like they seem really tense, or like, then I just kind of say, what's happening right now? I'm feeling something coming, like something's up right now. And then it just gets you, boom, right into present process.
Excellent. Yeah, and a follow-up question about that, about the focus. People are also asked about how to not get lost in stage 1, how to keep the focus in session, how to get back to the EFT model when a couple wants to or feels like they need to discuss the current challenge or issue that's coming up in the family unit or whatever it may be.
Yeah, I get that. I think this starts from like first contact with your client, and letting them know what EFT is, because clients believe, experience, see on TV, whatever you want to say, that when they go to couples therapy, they're going to report all the content of the relationship to the therapist, and the therapist is going to offer them a solution. So right from first contact, we should be letting people know how we work. EFT, what we do is we're looking at patterns, how you guys impact each other, how you get stuck, how that creates more emotional distance. And then we're going to look towards what's driving that, and then how to help you guys change that. So remind them of that often. First contact, we should be saying, hey, I'm an EFT therapist, or I'm trained in EFT, or the approach I'm going to use with you is EFT. Provide them with like a brief handout on EFT. Do everything to help build a stronger foundation from the get-go, which makes it easier for the client to like step on that foundation. Now, clients are still going to come in and they're going to content story you, and you're just going to remind them, right? I had like a third session with a couple, like third post assessment, and they came in and they're like all over the place with the content. I'm like, time out, time out, time out. I want to zoom out, time out. I want to kind of know generally, like, and I would just kind of get like pull them out of the content. The dangerous thing that we sometimes do as therapists is I think it's dangerous for EFT therapists, is we reflect content way too much. And if we're reflecting content, we're basically telling people to tell me more about the content. And then we're like stuck. And then we're like looping around in the content and we can't find our way out.
That's actually a follow-up question to that. How do we reflect process while including in our reflection some content so that there's not a disconnect with the client and the client will feel misunderstood?
I get that. And that is true. That can happen. If we're like totally dismissive, we don't want to be dismissive. We want to try to, first of all, the first thing we got to do is pull out, using clients' words, pull out something significant that they had shared in their like, whatever they're sharing with you. Pull out a word or a phrase that's their exact words, and then hand that back to them. Now you can like tweak in the content, like add it in, but it has to be like this small. And the phrase that was like kind of like an emotional entry point, that you want to make bigger so they can hear the content, but what they're really hearing you say is like, they say like, when we did da 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 da, and this was what happened to us, and we got in a fight with the dishwasher, and it really sucks, and I feel like he doesn't care about me, and it doesn't matter because I feel like I do everything. Oh, time out, time out, time out. Right. And try to catch I feel like he doesn't care about me, or I feel like I do everything. Pick one and then give that back to them.
Yeah. What I've seen you doing in the past and experienced it in your lives and other videos that I've watched in your training videos online. It's almost like you hand back the entire paragraph in short, but there's almost like if I visualize it like on text, it's the paragraph, but then there's parts that are highlighted, and those highlighted part is what sticks out. Is there any way you could put words in terms of how you do that?
The best thing that I could say is like, when it's the focus part of EFT is very important. So if we're thinking about it from that standpoint, we're looking, so imagine clients come in with a buffet. Like think of if anyone's ever been to a buffet of food or been to like some celebration, there's like 8,000 things to eat and choose from. If you are going to reflect every single thing to the client, you guys are all over the place and everybody becomes like a moving target. So what our job is again, we got to pull out a piece of that, like, like a chicken nugget. And we got to examine the chicken nugget, and we got to reflect the chicken nugget, and we got to talk about the texture and the flavor and the dipping sauces of the chicken nugget, not the, 8,000 other things that are on the buffet. So it is really key to like, I kind of what I call it is funnel it down. Clients say something, you pick out their words so they feel heard by you. And then we try to funnel it down to something, to like a more concise way of saying what they're saying, because they're like all over the place. And if you do that, they feel heard, supported, validated, all the things that we're wanting our clients to feel in EFT.
Sure. Another follow-up question of that is that when couples are really escalated and one of them shared content and the other one's adamant on making sure that the therapist is aware that what they shared was not it. Like one example they gave is a partner might say, he yelled at me. And then the husband in that case comes in and says, no, I did not yell. It's absolutely wrong. It's just factually wrong. And they're so ingrained in that. How do you navigate them back to watching the process that's going on right now in the room about them fighting about the content and getting lost?
Well, the first thing I would say is I would time them out. And I would say, what I'm noticing right now is as you share your experience, that's not landing very well on your side and you have a very different experience. Or I could say, hang on, time out. There's an energy shift that just happened here. Your voice went up and like something's that tells me something's happening for you right now. So we can move into the present with something like that to just hold up that mirror. And I think, like, why are we doing back to the basics in EFT? And it's our second one, is because I think there's like too much stuff out there, almost like too much stuff out there, that we forget what we're doing here. Our job is to hold up a mirror. We are process consultants, and we need to hold up a mirror and hold an attachment frame and work experientially. Everything else will come if we can do that. It's the structure of trying to follow steps and stages and tango moves and all these different, all the different, I don't know, steps and stages of everything. There's more steps and stages about different research out there now. And it gets too cognitive and we get too in our head. And then we're missing the most significant thing, which is how our clients are feeling in their attachment relationship and the pain that they have. How they're desperate to try to change that.
And what you're saying is how to reflect that playing out right now in front of us so that they can feel that.
Right. With empathy and curiosity. That's what I say. Like, say what you see with empathy and curiosity. It's like we have to learn how to be more descriptive in EFT. Like, I saw you look to the left or look down or fold your arms or take a deep sigh or wipe your tear. Like, it seems silly almost, I think, for some people to say those things. Those are some of the most powerful interventions that we could use in EFT, this say what you see stuff. And not, you seem sad, right? No, I see water in your eyes and I noticed that your voice got softer. I don't need to add sad. I got to get descriptive of what I'm seeing in front of me. That's the holding up the mirror.
Excellent. Excellent. So to shift a little bit, it's a broad question. People want to know, how do people actually get de-escalated? A bunch of questions about that. How do people get de-escalated? They come in very escalated in stage one. How do we de-escalate them?
By doing EFT. No, I'm just kidding. But that's a really good answer, isn't it?
Yes.
People get de-escalated. First and foremost, alliance is essential. If each member of your couple is not feeling heard, held, and seen by you, you're never going to get them de-escalated. It'll never work because someone's always going to feel like you're on the other person's side. You don't really get me. I'm being misunderstood right now. And if that's happening, walls are up. So forget de-escalation. You can't get de-escalation if you, the therapist, can't align with each member of the couple who have different perceptions of their relationship. Right. So that's like kind of like we have to risk our alliance. I have to lean in over here with you and say, yeah, I totally get it. It makes so much sense. Yeah, of course you get angry. I totally get it. What else would you do when you see your spouse on their phone all the time? Right. And I have to say those things and lean in over here. Then I have to come over here and say, and you look at your spouse all the time, or you see that disappointed look in their face or their voice gets raised. And then you're like, whoa, danger. I'll stay on my phone. It's so much safer to be on my phone. I totally get that. Of course, it's safer for you to be on your phone. Because when you look over there and you see your spouse with that look or that tone, it's like, woof, right? So that's like an individual validation of their experience in the cycle on both sides, risking that the other person could get angry because you're aligning with the enemy, right? Because people are the enemy in the beginning. The spouses are the enemy of each other. And that I would say is essential for de-escalation. First thing, forget about tracking cycles. If you don't give that clear signal to your people that each of them are heard, held, and seen in their experience that is very different, you're not going to be able to track cycles or even access emotion. You're going to keep spinning and spinning and spinning and trying and then being like, oh my God, this couple's so hard. Oh my God. Maybe they're, maybe he has Asperger's, or maybe she has borderline, or you're going to start thinking all these things that give you reason for them to not be appropriate for EFT. And they are appropriate for EFT. Couples are appropriate for EFT. So it's about, you got to go back. So if you're stuck, I want you to, this is what I say. If you're stuck in EFT anywhere, go back to the steps. And I know that sounds like the steps, like 1, 2, 3, 4, 5, 6, 7, 8, 9. Stage 1, cycle de-escalation. Stage 2, bonding events. Stage 3, consolidation, not the tango. Because the steps are the things that are going to help you figure out why you're stuck. Because you're going to look at number 1, alliance and assessment. That's step number 1. How is my alliance? Like with each member of the couple, is there something off? Am I frustrated with one of them? Do I feel like one of them is creating the block in therapy? There's your answer if that's happening for you, right? I'm going to throw attunement there in that one too. Can I attune to my client's emotional experience? Do I meet them where they are and attune to them? Or am I trying to bring them to where I am? There's your answer. If you're trying to bring them to where you are and not attuning to them, that's your answer as to why you're stuck. The next thing is, have I delineated, step 2, the cycle in a clear way so that if I asked my couple, hey, tell me what your cycle is, or whatever name they come up, pattern, dance, can you tell me what you know of it or how you see it playing out in your relationship? And if they say something like, oh, on the inside, when I feel like you don't care, I get angry or I start poking you. And then on the inside, you feel like you're not good enough for me. So you shut down. And then the more you shut down, the more we're disconnected or something like that. It doesn't have to be like perfect, but they have to know that there's an inside, outside that's keeping them stuck. So that's step number 2. Step number 3 in EFT, accessing emotion. Have they really accessed vulnerable emotion in session with you in relation to the cycle? If they have not, you are not going to get them de-escalated. That's key. People can't just know the cycle cognitively or rationally. We can't just do affect assembly on a cognitive way and write down cue, how it lands, what you tell yourself, what you do. I mean, yes, they can understand that cognitively, but if they're not in their feelings, they're not going to get de-escalated, because it's in those vulnerable feelings that are driving the cycle that helps us by the attachment reframe of our partner, which is step number 4 of EFT. So in order for me to believe that you shut down because you're afraid of making things worse because you don't want to lose me, right? That's the attachment reframe of you shutting down, right? I'm not going to believe that just by you saying it. I will believe it after I have seen enough time that live emotion in you, that's really, really there. Otherwise, I'm dismissing it, right? And you are not going to believe that all my anger and criticism and listing all your flaws is because I'm desperate to get close to you. That is crazy making for the withdrawer to think that that's what the pursuer is doing. However, when we access the emotion, the pursuer is feeling it in their body, and we're making that explicit, and we're connecting it to the outside behavior, and that emotion is live in the room, then the withdrawer is like, oh my goodness, maybe there is some truth here. Maybe you do want to be close to me. So those are your 4 steps in EFT, which I know there's like more movement to the tango, less movement on the steps. However, if you are stuck with a client that you can't get de-escalated, I highly recommend you go back to your steps and you ask yourself those questions for each one, and then you'll find out where you're stuck.
Yeah. Very well said. Very well said. And again, back to the basics. And I love the way you started with the basics. Attachment theory, alliance. If our alliance is off, that's a beautiful answer. Thank you so much. Interesting, something that came up for me in step 4 in the steps. Accessing emotion. There's the piece that you highlighted that then my partner could see where it's coming from within me. Is there something that happens to the person who's accessing their own emotions, their own vulnerable emotions, that's also a stepping stone to de-escalation? In other words, not just so that my partner could believe and see my vulnerability, but is there something for the person themselves when they're accessing it live that does something for them?
Yes.
Within.
Yes, because sometimes, not always, but sometimes the emotion, the inside vulnerable emotion, the accessed emotion that's driving the cycle is unconscious, right? So the individual who's accessing is also having an experience, a felt experience, excuse me, that that this is like they're not sending a clear signal, right? Like if I want to be close to you and I'm getting angry with you, or I'm listing all the things you do wrong in our relationship, that's not a clear signal. And there's no way you're coming close to me. So also the individual becomes aware that they're not sending clear signals. And honestly, that's a big part of EFT, especially in stage 2, right? We have to learn experientially how to reach for our partner from the deep, dark places inside and ask for comfort / attachment needs to be met, which is reserved for stage 2. But we don't ever do that. Like as like human beings, we rarely do that because nobody wants to go there and touch that.
Of course. We'd rather just keep that in the attic, locked up. Yeah, very well said. And I could also see how then step 5 follows after that, right? Because once I have the experience that I don't share this vulnerability as the first time I actually did it, then I could see more that instead I freeze you out or criticize you, and that's why you respond that way. So I can see how both step 4 within and in between creates a shift and allows for the de-escalation.
Are you talking about the tango steps or the EFT?
No, the EFT steps, meaning step 5, seeing that it's a cycle, that your reaction is more attributed to our move to the cycle than you don't care about me or whatever, or I'm not good enough. In order to see that, right, as far as I remember from our supervision days, is that that final step of de-escalation is knowing that when I see the response from my partner that I don't want, that's 4. Okay, that's why I mixed that up.
I don't want to, I'm sorry to interrupt you, but I didn't want people getting confused. That's why I was like, wait, are you talking about the tango? Step
Okay.
3 is accessing emotion. Step 4 is buying the attachment reframe.
Okay, sorry. Yes. So, but yeah, I can see how both accessing the emotion allows for the reframe, the cycle reframe, both within and in between for both partners.
Correct. And thank you for adding that. That's really important, right? I learned something about me as I'm accessing emotion and linking it to my behavior in the cycle,
Right.
why it's so hard for me to send, clear signals that I'm in attachment distress.
Sure. So another question, interesting to hear what you'd say about it. Again, basic question. How do we access blocks and how do we get past them, or how do we deal with them when they come up?
That's such an interesting, the first part of that is how do we access blocks? I'm like, blocks are right there. Like, I don't know. I'm not sure if we actually have to access them or if, oh, hello, they just keep showing up for us.
Imagine as I wrote this question that they meant, but I don't know, that they meant how do we access the fear behind the block? Like the block comes up, but how do I see that it's a fear block? That's how I made sense of it, but I don't know.
Well, first thing I want to say is like, I think there's a little bit of misconception out there that blocks are bad in EFT and that your job is to blow it up with a grenade so your clients can find their happiness, peace, and emotional connection. And that's a misconception. Blocks are opportunities for us to hold up a mirror and validate the protection that people use in the cycle. I mean, it's a big deal. Like a block is when we can make a block explicit by holding up that mirror and saying something just happened to you right now. Like when your partner shared ABC, and let's say they shared it vulnerably, and the other person says, I don't trust that. That's a block, right? So we could say to them, lean in and get curious. Oh, something happened for you when you heard your spouse say that. When they turned to you and they shared XYZ and their voice was soft and they had tears in their eyes, something that landed somewhere in you because you said, I don't believe that. Can you help me with that? Can you help me figure out like what happened for you? Because then I could take all that and I could put it in the cycle. So this is the cycle at play right now, right? You partner tried to do something a little different. And then this person over here, cycle, boom. right? The cycle is right here in the room right now. So they're amazing opportunities to show why this couple is so stuck in the cycle experientially, which is why we're working in the present. So I want people to think about stage one much more. And I have a booster on this, by the way, working with blocks, about like as if we're artists with a chisel, and we are chiseling away at the block to make it into something beautiful, not blowing it up with a grenade. I don't need to move a boulder. I just need to keep chiseling away until it's small enough that I can gently move it and help people find each other emotionally.
Well said. So, stepping into stage two, people wanted to know stage two. How many sessions does it usually take to complete withdrawal, re-engagement, and pursuer softening? Is it multiple? If it is multiple, do you stay with the withdrawer first for a couple of sessions and then move to the pursuer softening? Do you alternate?
I personally, I don't like giving session numbers for things, because I think what that does is it puts pressure on therapists to perform in that way, which often creates cognitive EFT. So if I tell you withdrawal re-engagement should be done in 3 sessions, and you're like, okay, and you become robotic, and you do take your 3 sessions and woof, you're done. And then if I say you can do pursuer softening in the extended longer session, like a 90-minute session or something like that, you can do it in 1 session because it's a different experience. And then you go and you want to do it, it becomes robotic. So I'm just saying that outright right now. So I will say a couple of things about this to help with answer that. You have to do withdrawal re-engagement enough so that the pursuer trusts the withdrawer, at least a little bit, not fully, but they have to trust that this withdrawer has integrated their own attachment needs and longings, has integrated their view of the world, attachment related view of the world, and integrated their view of self, their attachment related view of self, like, which is all the emotional stuff inside, right? That's all the stuff that we're doing in stage 2, step 5. But we're trying to integrate these disowned parts back into the body rather than leaving them in the attic. So I have to sit next to you and experience you in that place enough times that there's a good chance that you could show up for me in that same way. Does that make sense?
Perfect sense. Yeah.
Right. So, oh, excuse me. Sorry. So however many sessions that takes, here's the thing. If you want to do withdrawal engagement in 3 sessions, and go back and watch your 3 sessions, because, taping is essential, and make sure we're looking at experiencing and level of experiencing, and that the withdrawer is actually in their experience and emotional, and it's not cognitive, right? They're actually feeling, and we could see it as we watch the session. We could feel it in our own bodies as we're watching the session, because we are not good evaluators of ourselves when we're sitting in a therapist chair. We should never do that. And then when you try to do a pursuer softening, if you're hitting blocks, lean in and be curious. Like, what is this? Here right now is your partner who's been here showing up, the very thing that you're longing for, recognizing his own, his or her, sorry, own needs for closeness with you. And this is like, you're not alone in that longing. And then there's something right here that's getting in the way. I don't understand what it is. Can you please help me? Right. And just hold up the mirror, hold it up, hold it up, hold it up. And then you'll figure out what the block is there for a pursuer softening. And maybe it's that they actually can't trust. Maybe this is where an attachment injury can come out, or like an abuse history that they decided to not disclose to you in the beginning. Anything can come out here. But we can't push a pursuer to a pursuer softening. And if they don't trust that the withdrawer is going to catch them, they're not going to jump. So, and session number, I don't know. You'll have to see. Maybe a couple for the withdrawer and a couple for the pursuer.
Perfect. Any words you can say about reads or tells, where you know that it's enough to move to pursuer softening? any reads that happen in the room that can be kind of like signposts for us, like, okay, we're there, we're ready to see if we can engage in pursuer softening now?
This is where I go back to the steps again, right? I got to go through all of my steps again. And this is what I did, by the way, when I learned EFT, like, 20 years ago. I used the steps were my guideline. There was no affinity loop. There was no cycle tracking forms and all these EFT workbooks and hold me tight. There was literally 9 steps of EFT. So I would always have my steps out and I would look, where is the couple? Where am I / the couple on the steps, right? Always checking my alliance, seeing if they know their cycle, making sure I make reference to the cycle in every session, accessing emotion by the attachment reframe, which also means they are interrupting their cycle at home. They're being able to come back to each other if there is a cycle at home and repair it without my help, right? And they're able to share, take some vulnerable risks outside of session, right? They start to see the cycle as its own dynamic and the enemy that's hurting them. And they're both kind of wanting to come together like side by side and look at the cycle over there. So that all that stuff is like what we're looking for our first change event, which is cycle de-escalation.
Right.
So then once we have, and that's why the steps are helpful, because this is what you want to go through to see, where am I with this couple? Where are they? And then we're going to look at stage 2, withdrawal re-engagement first, which is step 5, 6, 7. And step 5 is the integration of disowned parts of self. That's the best way for me to describe it. It has to do with attachment, longings, fears, view of self, and view of other. And view of self is obviously the deepest, darkest place that we travel down to the elevator to the bottom floor. Have I done that? Have I done that with the withdrawer? Has the withdrawer done that with my assistance? And has the pursuer been able to show emotional presence and acceptance in that place? Right? Step 6 of EFT. The pursuer says, I'm here with you. I get it. I don't want you to be alone in this place where you feel weak and there's something wrong with you because blah, 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 blah. I'm here. I get it. I totally know that it makes sense why you feel this way. But we help the pursuer say those things. Like they're not going to just naturally know what to do. We help them by seeding the answer a little bit, asking the right questions. And then the withdrawer has to ask for what they need in the same session, or the next session, but I'm just saying, like, to kind of tie the bow on withdrawal re-engagement, has my withdrawer from the elevator down to the bottom floor / view of self, has the withdrawer asked for what they need. I need to know that you're not going to leave me. I need to know that if I mess up in our relationship, that you're not bailing. I need to know that I can make a mistake and you're still going to love me. Which is, I mean, when you're in the darkness at the bottom of the elevator, that's a hard ask, but it's an important ask because that is the bonding event that needs to happen for withdrawal re-engagement change event number 2. So again, we're going through our steps again and we're seeing, and then we say, oh, now I can go for pursuer softening. And then see all the blocks that come up. And I say that their blocks will show up in withdrawal re-engagement too, but they're baby blocks. Because remember, we've been chiseling all through stage 1. We've been chiseling at our block. And then there's like little fragments floating around in the air. So sometimes we bump into a block and we say, yes, 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 I totally get it. Yes, I know right here, the fear is that the cycle is going to come up. I totally get it. I'm wondering if we can gently put that aside and stay in this moment right now. Like, I'm wondering if we can do that right now. And if you can't, you can't. Then you just go with the block, right? Then you just got to go there. And then they got to share whatever their fear is or whatever's going on. And sometimes they can say, okay, like kind of like, okay, I'm willing to take the risk. Pursuers will get stuck in fear in a pursuer softening. And our job is to not push them off the cliff and dismiss their fear. Our job is to hang out with them and reprocess that fear with them and send over enactments around their fear of trusting other, right, is a big deal for pursuers because pursuers have been on the top of that cliff or walking up the cliff, jumping off, walking up, jumping off, like their whole lives. And every time they jump off the cliff, no one's there to catch them. And they're so desperate to be caught. So when we have them at the edge of the cliff after, 20 years or 40 years or whatever, or 10,000 jumps and no one's ever caught me, the therapist is going to say, okay, now you can jump. And I'm going to push you. No, we're going to stand up there. We're going to look down. We're going to see how scary it is. We're going to hang out with them. We're going to validate the heck out of that. We're going to send over that fear. We're going to see how the withdrawer responds to the fear in hopes that we can have the withdrawer like show up for them right here, right now with support and presence. Like, I get it. Of course you're afraid. It makes so much sense. It's okay. I'm here with you. Right. So that's like a big part of pursuer softening, is hanging out with the fear, which is a block that we can chip away at by doing the work, experiential work right here, right now.
Okay, excellent. There was a bunch of questions on stage 2, but I think you pretty much covered them all.
Oh no, sorry. I know I was talking forever.
That was
Yeah.
great. No, not at all. That was actually great. I really just answered all the key questions that everybody had. I'm sure you've been training people and doing this for a long time, so it just comes natural to you, where people struggle in stage 2. Some questions about between the couple. How do I intervene when one partner is criticizing, blaming, or accusing the other? Is the intervention different if it's more chronic, if it keeps happening more regularly?
No, I don't think the intervention is different. I'm not exactly sure what that person means, but I wouldn't say the intervention is different. I would say, you guys are going to love this, it goes back to alliance, right? If they feel heard, held, and seen by you, you get to say in session when you see it in session, because we're always looking to work in the present moment. We're looking for the criticism and the listing of flaws in session. We got to say, hey, I'm noticing something. You're continuing to like point the finger over there and like telling me the things that your husband's doing wrong or your wife's doing wrong. Can you talk to me about what's going on right here as you're sitting here right now, or where that's coming from? So people get scared of pursuers. That's the reality. Like, I mean, I guess people are also scared of withdrawers too, but pursuers can be scary because, they're like the caged animal that's like, right? Not all of them, but some of them. And if they raise their voice or if they turn on the therapist, which they can do also, people get scared to be explicit about the behavior, which is why alliance is so important. We have to give our pursuers like, I'm with you, I got you, tons. You cannot over-validate a pursuer. Of course, yes, it makes so much sense. I know, I get why you do that. There's no good option for you at all in that position when you're dying inside and that your spouse has been XYZ. You're like, your body says, danger, danger, danger. I'm not doing it. I'm not doing it. I'm not doing it. Over and over and over again, which when they get that, they feel seen, by the way, which is one of the things pursuers are aiming for, to feel seen, to exist, to not feel invisible, which my withdrawers who are on this call might be going, wait a second, pursuers are completely seen because they're all big and blah, right? But they're big and like that because they're trying to be seen, and then no one really sees them because everybody runs away from them when they're like that, including therapists. And our job is to lean in and say, oh my goodness, oh my goodness, oh my goodness, you're so upset right now. I hear your voice going up. I get it. I get it. Can you hang on here? Talk to me. Talk to me. I say that a lot. If people are ramped up in session, I say, hang on, talk to me. I need you to talk to me about this. It's too hard right now to talk to your partner. Tell me what's happening right now as your voice is getting ratcheted up, as you're like saying all the things that your spouse is doing wrong and the fingers pointing over there. What's happening right here? Take me to here. So being direct in EFT is another very important thing that for some people that can be a learning edge, right? Session management and being direct. You can't expect your clients to take you to the places that they need to go. As an EFT therapist, my job is to point you to where you need to go, always. I'm always pointing you. And the more I point to you where you need to go, which is experiential, like attachment-based, working with live emotions, staying in the present, all those great things that we do, the stronger my foundation is for that. And the more that I do that, through that process, clients become good EFT clients because they've had experience with you as a therapist, and now they're like, oh, that's not even appear. It's like a felt experience in their body. So they start to move away from being all over the place.
Yeah. I love that visual and being so direct about it. I know you talk a lot about what your partner is doing and take me here, tell me what's happening right here, right now for you. That visual and just pointing to your heart just seems so clear and direct. That's
Mhm.
really awesome. Any words of encouragement of what you can share with the therapist over here? Because you did mention that session management could be hard, being direct could be hard. You mentioned some of the some things, specific dynamics that we can get scared that our pursuer or any client will start attacking us for interrupting them, or any words that you can say to support people in this process to have more self-confidence or confidence in the process to be able to do that?
Yes, that's such a great question. I think the struggle that people have is um, that they have too much going on inside their mind, and they're juggling, 12 plates in session of what they're supposed to do in EFT. And that's the block. That becomes the therapist block. That's why the learning edge is so hard. That's why they get stuck here, 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 and here, is because they're doing this in their head of juggling 12 plates. And you can, or spinning plates, whatever. You spin plates, I guess. You juggle something else. But that becomes a huge block because then you're missing what's happening right in front of you. So sometimes I say we got to take all the podcasts, all the cognitive training, all the rational stuff about EFT that we understand, intellectualizing, psychoeducational stuff, leave it at the door before we walk into our therapy session and show up from a place of openness and caring about your client. Like you care about this couple. Like there's couples that I can say, I love my couples. Like I like most of them. I really like some. And then there's some that I just absolutely love. So when I'm sitting with them, that is being conveyed from me, right? And I think that, if you go back to like basic research of what makes therapy successful, it's the relationship with the therapist. So if people are spinning plates, there's where you're going to hit all your blocks, because it is about using yourself and your emotional presence in the room to guide you, working experientially, following live emotion, and holding an attachment frame. To me, that's the most funneled down thing that I can say. If you want to do good EFT, this is what you need to do.
So a follow-up to self as therapist, somebody posted on the chat. Do you have any additional tips or strategies for self-care post-session, especially the sessions that can be particularly challenging, triggering, emotionally charged, overwhelming, scary?
Yes. You need somebody to hug afterwards. And if you don't have somebody to hug, I think you need to imagine somebody there to hold you, to soothe you, to like, kind of like do something like this, especially when the attack is coming at you. Those sessions can be really hard. I do think like it's kind of dependent on like what you believe in as a person right now. Like, but I feel like it's like I think of EFT as it's like energy work in a way. I know we're working with emotion is experiential, but I feel like it's really energy work. So what your clients, the emotion in the room is flowing through your body, because that's the thing that helps you be present. And that's the thing that where we get success in EFT is as the emotion is flowing, the energy is flowing. The key here is to make sure the energy flows back out of you. The anger, the frustration, the pain, the deep pain that people feel, we have to flow that back out. So after a session, we might need to take a few minutes if we can't find somebody to give us a hug, or we can't get that imagined other to hold us or hug us, or whether it's like a partner, a parent, a best friend, somebody who like really cares about it, a supervisor to say like, I get it. Like just imagine that they're soothing you, right? If you don't have that, for some reason, well, first try to find that, because supervisors or trainers are available for people to do the soothing. You need to like pause yourself and like clear your energy, whatever that looks like, meditate, like breathe it out, like try to get that out of your system, because self-care is so important in EFT. If we're going in with our hearts open and like feeling all the stuff that's going on in session, like we have to find a way to like, poof, get it back out.
Yeah. Excellent answer and excellent question whoever posed it. People wanted you to speak about the basic of the 3A's, the counter indicators, and we got a couple of people who specifically wanted to speak about safety, interpersonal violence, I think is the word they used. So abuse part of the 3A's.
So I'm not exactly sure what they're looking for, but I'm going to say that that's a really important thing that you are to assess and determine appropriateness for treatment. So that's part of our assessment. So that goes back to like session 1, 2, 3. Like, how do we assess this? And then we make a clinical recommendation based on our assessment. So if I'm sitting here and I think this is intimate partner violence, I'm not going to do EFT. How could I? Because I can't create safety. The A's are there because they're blocks to emotional safety. So when we look at contraindications for a full course of EFT, that's what we're looking at. We're looking at, if I can't build emotional safety here and someone's going to get more injured, maybe I need to refer them out. And I feel like this is a question that I get like a lot. And I really want therapists to trust your own clinical judgment here. Like, just because you're assessing it this way and I might assess it differently, and Joseph, you might assess it differently, that's okay. What matters is how we've assessed it. And then we need to make a clinical recommendation based on all our years of experience. We have to make a clinical recommendation on that.
All right, so I'm going to ask a very challenging question over here. How do we do this in good consciousness when we bought into the EFT model so much? So what am I really referring the person out for? Because if in my heart and hearts, I believe that even the person who's doing the violence, what they really need is EFT, then where am I really referring them out to in good consciousness?
If that's your belief, then I feel like you can refer them out to EFT therapists, individual, until like the intimate partner violence thing feels like, I mean, because I believe that that's attachment based, right? So, and do some EFT, right? Like for the person who's the perpetrator, and also the who is the victim, right? Like, we're going to do some EFT attachment based experiential therapy with them, and then we can bring them back together. This is why having EFT therapists in your area that are trained is so important. And I would say I wouldn't refer anyone to someone who's not EFT trained. And because I specialize in couples therapy, I want that person to have had an externship at minimum. Because I know now we have our 3 tracks, blah, blah, blah. If you want to do EFIT and EFFT, you don't have to take the externship. It's way too important for me to refer people out. If I'm the couples therapist, I need to know that the person I'm referring to has that basic understanding of EFT with couples. And then I can refer them out. I could also choose to make the decision of doing the individual work or offering that to the clients. I mean, again, it's like personal preference. People have different issues around that, and which is okay. So that's what I would say about that.
Yeah, so the importance of still, when referring them out, if we want to be true to ourselves, make sure we're referring to somebody who is working attachment-based experientially with that individual.
Yes, if that's what our clinical recommendation, I think that's what I'm going to go back to. Is this your clinical recommendation? Then trust yourself. If your clinical recommendation is this is domestic violence and this person needs to go to a domestic violence treatment center, then that's your recommendation. And then they can come back and see you in 6 months or something, right? So you have to that's for the individual therapist. We're professionals in this field. We have training, we have experience. Like, the more experience we have, the sharper our clinical skills get, right? So it's like I can't tell somebody you're wrong for your clinical recommendation. I would never say that.
Right.
Say that makes so much sense because of your experience. So that referral, of course, do that.
So one more question to be asked is, how do you suggest medication to somebody if you feel that somebody would benefit from medication? How do you bring that up? The concern, I guess, is losing the alliance. It wasn't explicit, but
Yeah. I would, so for medication, so anything, whether it's medication or additional individual therapy with an EFT therapist because of something that I'm noticing in session or something, I will not make that referral until like 15 sessions in ish. I'll just throw out a random number because my goal is to see if they have the buy-in and they can see the cycle and if that could change something like the anxiety or the depression. Now, if someone is suicidal or psychotic, like, I mean, obviously we're going to refer them out. Your everyday person who's anxious or depressed, like, even if they're like super anxious and they're like this all the time and they're buzzing, it's because they have an insecure attachment and they've had that their whole life. And it's showing up that way. So if we can do some work, we might find that the buzz knocks down a tinge, or we might find that it doesn't. At that time, 12 sessions in or 15 sessions in, I have a good alliance with both of them. So I'm comfortable then of saying, I'm concerned for you. Like, I know this has been so hard and I think this might help just a tinge. Are you open to that idea?
so yeah, it falls back on the basics on the alliance, right? Which is what attachment theory is, right? That's the basics of attachment theory. Without them feeling us as a secure base, they are not going to have enough breadth to explore different things, and they're going to perceive it as threatening and attacking or whatever it is.
That's right.
Yeah.
That's
And an interesting question. Nobody wrote this, but thank you for everything. As we're about to close up here, thank you for everything, Debbie, and thank you for your expertise. Is there anything that on your end, Debbie, you feel is important for the viewers here to know in terms of, and you said a lot of it already, any last words over here for us in terms of what the basics are, what we could be doing, what's important to most focus on?
Yeah, I mean, I think one thing that popped in my head along the way that I forgot to say out loud is those of you who have been trained by me, I talk about EFT mini goals, which I think are very important. Like if you want to learn this model, number one, you need to tape yourself, you need supervision, and you need what I call mini goals. And you need a notebook. And you need to write down your focus for the week, which could be say what you see. And then you are going to do that for an entire week. And then you're going to watch 15 minutes of tape and you're going to see if you did that. And if you didn't do that, you're going to carry that mini goal over to the next week. And you carry the mini goal over until you get it, until you see yourself doing it. And then because you're building up muscles that you haven't used before. So it could take you a while to really get that one in your body. Your next one could be validation. Write that down as your next goal in your little notebook. So we're really taking the model, like it's like a 500-piece model, the art of EFT, and try to learn each little artistic piece at a time rather than, 500-piece puzzle. Oh, let me carry the whole thing in and try to put it together while I'm sitting in session with my clients. That's like a setup for feeling inadequate. And last thing I'll say is like, it's really common for people to get into a cycle with the model of EFT, which means I'm trying to do this thing that means so much to me and I'm so passionate about. And then the feedback I'm getting from the model is I'm inadequate, I'm not enough, it's not working, I'm failing somehow. And then I'm in my head to try to do a better job because I don't trust the process. So then I get into a negative cycle with the model of EFT. So be on the lookout for that. Practice self-compassion. Like let yourself learn how to do EFT. Let yourself learn how to enhance your skills in EFT. Even if for anyone on the call who's certified, I still learn stuff about EFT. And I've been certified and a trainer for like, it feels like 100 years, but I'm not 100 years old, so it must be less. I still learn when I watch sessions. So let yourself learn, be always open to that. That's the beauty of this model is it keeps us engaged because we can learn things as we go, which is exciting.
Yeah, well said. And I'm just reflecting some on my own journey and in supervision with you. I definitely had a cycle with the model, right? I'm an anxious pursuer, so I was really anxious to get EFT, and I was rushing through my sessions, as you remember, Debbie. And I remember you doing with me exactly what you're saying right now. I remember where my goal, for example, for the week, and this was the hardest one for me for some reason, is to attachify. For some reason, I have a very hard time because you love him, because you love her. I had a very hard time with it. So, and I remember even there was a time where like I put it away because I didn't make headway and broke other mini goals that I was successful in before I brought that up to be successful in that one as well. So definitely through experience that has been extremely helpful. And like you said, relieves a lot of pressure off
Mm.
us as learning them.
Yeah, I totally. And attachify is a big thing. If you
Mhm.
are bringing it back to the relationship and saying you care about this person or you love this person, or this was the person who was supposed to have your back,
Right.
is the person who is supposed to love you more than anything. Like if we're not saying those things and being mushy gushy or finding our way to get more comfortable to be mushy gushy in that attachment way, we're missing a huge part of EFT.
Absolutely. All right, this has been wonderful and really a tremendously learning experience. Thank you, everybody, for being. Thank you, Debbie, for being here and creating the community with us. Everybody, please stay connected. Stay connected to EFTCNJ. If you have any questions or any requests or any other work that you would like to see us doing, please hit us up, ask for it, and yeah.
Thank you, Yosef. And I want to do a big shout out to EFTCNJ for putting this together and the hard work that goes on to like kind of bring a free Q&A to you guys. And our goal is to do it, I think, quarterly, at least quarterly, so we can keep helping you guys like integrate EFT on deeper levels. So it was great. And thanks to EFTCNJ for doing it.
Yeah, special thank you to the people involved behind Abby Lou, Simi Lichtman, and Arne Hirschfeld and myself. So thank you everybody. I added myself last because literally I'm the least the least one putting in work over there. I'm humbled by the amount of work that the other three are putting in. So thank you, thank you. All right, thank you everybody. Great seeing your names.
Bye, everybody. Thank
Bye.
you.
Bye. Thank you.